so first thing I'll be doing is reviewing the physician's orders and the reason for the catheter. And I do see this is for nursing Jake, fitness 312-654-987. Date of birth is January 1st, 1960. Doctor skills lab, and patient has no more allergies. And over here I do see there's an order to insert Foley catheter now, and the reason is to monitor fluid balance ins and outs closely. And this is signed by transcriber and viewer and signed by physician signature. Okay, and I will be bringing the physician sheet into the room so I can compare and verify the patient's ID. And now I can put my physician's orders down, perform hand hygiene, and period care has already been done on my patient prior to this. And now I can collect my supplies. I'll be needing a drainage bag. I'll be needing a size 14 French catheter, and I'll be needing my sterile gloves and a catheterization tray. Okay, now I have my supplies. I can go ahead and enter my patient's room. And upon entering patient's room, it's going to do an entry safety check. There's no tripping hazards, call bells and reach, patient's under distress, and bed is in the lowest position possible. And now I can put my supplies down, perform hand hygiene, and now I can introduce myself to the patient. Hi, my name is Mohit. Kaushal. I'm a student nurse from the University of Manitoba. I'm going to be taking care of you today. And can I just verify your ID with your armband? Okay, perfect. Nursing Jake, fitness 312-654-987. January 1st, date of birth is January 1st, 1960. Doctor skills lab, and patient has no more allergies. Could you please tell me your full name and date of birth, please? Okay, nursing Jake, January 1st, 1960. And do you have any allergies? Okay, and patient has no allergies, and I can put my physician's orders down now. Okay, Mr. Jake, today I'm going to be inserting a Foley catheter on you, and the reason for this is so we can monitor your ins and outs closely. And the procedure just involves me inserting a sterile tube up your urethra that's inflated and kept in place by a balloon that's inflated, and it's inflated with sterile water. And the whole system connects to a drainage bag, and this just drains your urine, and this allows us to monitor your ins and outs closely, which is the reason for the insertion. And are you okay with this procedure? Okay, Jake has said yes. Okay, now Jake has said yes, I'm just going to perform hand hygiene and start getting set up. First thing I'll be doing is attaching my drainage bag to a non-movable part of the bed, such as the bed frame. Right there. I'll be clipping this to the bed sheets. Okay, once I've done that, I can help my patient sit up in a comfortable position. Since my patient is male, I'll be putting him in a supine position with thighs slightly abducted, putting the bed at waist level, and I'll be uncovering my patient. And after that, I'm ready to start opening up my catheterization tray. And I can just put these to the side. I will not be needing these yet. And I can put the physician doors to the side as well. And now I can open my catheterization tray. I'll be going away from me, to the side, and then I will be pulling out the blue sterile forceps. And first thing I'll be doing is passing myself the drape. Using the 1-inch borders. Okay, and I can now put this blue forceps down, and this drape just goes in between the patient's legs. I'll be putting that right there. And next thing I'll be doing is just passing myself the blue fenestrated drape. Okay, I'll be using the 1-inch border to pass this to myself. Okay, and I'll be putting the blue forceps down within the 1-inch border. And this drape just goes on the patient's penile area, as is. And I can fix that later if I need to. Okay, and now I will just be passing myself the garbage. Okay, and the garbage is going to be used as a clean surface. And currently I do not have enough room to fully open up the garbage, therefore I will just be opening it up, opening up a quarter of the way and then just leaving it right here. And we can pretend this is my garbage. Okay, and now I'm ready to take out my catheter from my catheter pack, and I will be maintaining sterility of the blue packet that's inside, which is considered sterile. I will be bringing this back, and I will be pulling out the catheter using the blue package on my blue sterile forceps. Okay, and now I can discard this and I can pick that up after. I can put this in my boat. And I just want to verbalize that for this procedure, I may need to turn my back to the sterile field, but in a clinical setting, I would not be doing that just because I would have more room to maneuver around. And currently, I am limited on space. And okay, now I'm ready to don my sterile gloves. I'll be donning my sterile gloves right here. And I can just discard this. And I'll be handling this within the 1-inch borders. first thing we'll be doing is taking my right glove and putting it on. Okay, and I can just fix that with my finger. Okay, there we go. And next thing we're doing is using my putting on my left glove. Okay, once I have it on, I can adjust it and fix, since it is just sterile to sterile. Okay, now it is just sterile to sterile, and now I can touch everything in my boat. I can touch everything, and before I touch everything in my boat, I'm actually just going to be discarding this from using the inside. And I can just discard that, pick that up after. And I am just going to be touching, first thing we're doing is taking my catheter. And I'm going to be pulling that out of the packet itself, ripping it open. And then I'm just going to be pulling the catheter out. Okay, and this can go into this can be discarded. I can pick that up after. Okay, and I can just put this way. And now I'm just going to be taking my 10cc syringe, uncapping this, dropping this, and then this can be picked up after. I'm going to be attaching this to the port of the catheter so it's readily accessible. And now I'm just going to be taking my povidone sticks, ripping them open, making sure they're readily accessible for when I clean the penile area. And now I'm going to be taking the catheter itself, and we'll be lubing this up. I'm going to be ripping open the lube. Okay, there we go. I'm just going to be making sure this catheter is nicely lubed up for my patient. Okay, and now that I'm done that, I can discard this, and I can pick that up after. Okay, I'm now ready to move the boat into my patient's thighs. Okay, I'll be taking this. I'll be putting this in between my patient's legs. I'll be putting the boat right there. And now I'm just gonna be holding the shaft of the penis with my non-dominant hand. And I'll be taking my povidone sticks, and I'll be cleaning the penis out from the urethral meatus outwards in a circular motion towards the base of the glands. And if my patient wasn't circumcised, I would retract the foreskin. Okay, one swipe. Garbage. 2 swipe out from the urethral meatus in a circular motion. Garbage. And then now I'm going to be doing my last swipe, and then garbage. Okay, now that that is done, I'm ready to insert my catheter, and I will be taking my catheter. and I will just be telling my patient to bear down. I'll insert my patient to bear down as I insert the catheter. Okay, Jake, when we inserting the catheter, could you take some deep breaths and bear down? Okay, I'm inserting a catheter. And I'm supposed to insert the catheter 6 to 8 inches. And I'm inserted the catheter 6 to 8 inches. I do see urine flowing out in my boat now. And I will just insert the catheter 1 to 2 inches more. Okay, and now I'm just going to take my syringe, and I'm going to stabilize the catheter with my non-dominant hand. And I'm going to be inflating the catheter. Okay, now that I've done that, I will just be pulling back on the catheter to meet resistance. And I meet resistance right there. I'm meeting resistance, and now I can take my hand off this, and then I can unscrew off the syringe, and now I can discard the syringe into the garbage. Okay, I'm just going to be hooking the catheter port onto my boat. Right there. And now I'm just going to be getting my drainage tube, and I'm going to be unclipping it from the bed sheets. And now I'm just going to be maintaining sterility of what's under the blue cap over here. And I'm going to be putting this in the garbage. And I'm going to be attaching this to the port right here. Okay, now that I have done that, I'm just going to be performing pericare on my patient. I'm going to be performing pericare on my patient and cleaning up any excess fluid that there is. And I'm going to be cleaning up the supplies over here. Cleaning up the supplies, such as the boat. I do not need the boat anymore. I can get rid of the boat. I can put the boat in the garbage over here. And I can put the boat in the garbage over there. And after I do pericare, I would also secure the drainage tube to the patient's thigh with the tape, just to make sure the catheter doesn't get pulled out or yanked. And I would rip open the fenestrated drape and discard that as well. But for demo purposes, I'm not going to be doing that. And after I've done that, I can after I've cleaned the patient up and everything, done pericare, and I can remove my sterile clean gloves now. And then I can do hand hygiene. And now I can do my exit safety check, making sure call bell's in reach, bed is in the lowest position possible, patient not in distress, and there's no tripping hazards. And now I would go document in my IPN. Some of the things I would document in my IPN is the date and the time the catheter was inserted, and the reason why it was inserted. It was inserted to monitor patients' ins and outs closely, and it was inserted as per physician orders. And I inserted a size 14 French catheter with a 10 cc with a balloon inflating 10 cc's of sterile water, and the amount flowed up into my boat was upon insertion was about 800 mLs of pale amber urine with no sediment or foul odor. And I took one try to insert the catheter, and the patient tolerated the procedure fairly well. And the procedure was fairly well, and it was done with minimal resistance. And we should now be monitoring patients' ins and outs every hour. And patients' minimum urine output every hour should be at least 30 milliliters per 30 milliliters. And now we should also be monitoring patient for any signs and symptoms of infection, such as a high white blood cell count and a fever. Okay, now that I have done that, I will document those in my IPN. Now that I have done that.
Okay, so now you have order to remove the Foley catheter.
Remove the Foley catheter. Okay, now that I have an order to remove the Foley catheter, I would just review the physician's orders and the reason for the removal. I do see this is for nursing Jake, fitness 312-654-987, and date of birth is January 1st, 1960, doctor's skills lab, patient has no known allergies, and I do see there's an order to remove the Foley catheter, and the reason is we do not need to monitor patients' ins and outs as closely anymore, and this is signed by a transcriber and a reviewer and does have a physician's signature on it. Okay, now that I have reviewed the physician's order to remove the Foley catheter and the reason why, I'm going to do hand hygiene, and I'm going to be collecting my supplies. I will be needing a blue absorbent pad, my clean gloves, and I will be needing my 10 cc syringe. And pericare has already been done on my patient prior to this. And once I have my supplies, I will be also be taking my physician's order into my room to verify the ID. And upon it, I would be going to the patient's room now. And once I have my supplies, I will be entering the patient's room, doing my entry safety check, making sure call bell's in reach, patient's not in distress, bed is in the lowest position possible, and there's no tripping hazards. Once I've done that, I'll be able to set my supplies down, do hand hygiene, and now I can go ahead and introduce myself to the patient. Hi, my name is Mohit Kaushal. I'm a student nurse from the University of Manitoba. I'm going to be taking care of you today. And can I just verify your ID with your armband? Okay, perfect. Nursing Jake, fitness 312-654-987-987. Date of birth is January 1st, 1960. Date of birth is January 1st, 1960. Doctor's skills lab. Patient has no known allergies. Could you please tell me your full name and date of birth, please? Okay, nursing Jake in January 1st, 1960. Okay, perfect. And do you have any drug allergies? No allergies? Okay, perfect. That's exactly what we have on file. Okay, now I'm just going to explain the procedure to my patient. Okay, Mr. Jake, today I'm going to be removing your Foley catheter, and the reason for this is that we do not need to monitor your ins and outs as closely anymore. And this procedure just involves me deflating the balloon that sits in your bladder currently, and I'm just going to be deflating it with a 10 cc syringe. That's what's filling the balloon, and inflating the balloon is 10 milliliters of sterile water. So I'll be deflating that and pulling the catheter out. And this is just a clean process. And are you okay with this procedure? Jake has said yes. And once Jake has said yes, I'll just be helping him sit in a supine position. And I'll be putting a blue absorbent pad under his buttocks, which I currently do not have right now, so I will be compensating for it with this pad right here. I'll be pretending I'm putting that under his buttocks, and after that, I will just be doing hand hygiene, and I will be putting on my clean gloves. I'll be putting on my clean gloves now. Okay, now that my clean gloves are on, I will just be going to go and assess the drainage bag. First thing I'll be assessing the drainage bag, and over here it looks like we have 300 mLs of pale amber urine with no foul odor or sediment, and those are some of the characteristics I'm going to be taking down into my IPN. And I will be emptying this. Emptying the drainage bag, and now I can go ahead and first thing I'll do is attach the 10cc syringe to the before attaching the 10cc syringe to the catheter, I would be unsecuring the tape from the patient's leg, and I would just be taking the tape off. And now I would be attaching the 10cc syringe to the port of the catheter. Okay, now it's letting the solution draw back slowly. So making sure I withdraw all of the solution. Okay, I've withdrawn all of the solution, and now I'm just going to be instructing my patient to bear down as I'm removing the catheter and take a couple deep breaths. Okay, Jake, I'm going to be removing the catheter. Please take a couple deep breaths. Okay, and upon removal of the catheter, I pull out the catheter. Upon removal, I'm going to be inspecting the tip to make sure it is whole and intact, and the tip is whole and intact. Okay, once I've assessed the tip, I can just wrap everything in the drainage, in the absorbent pad, and I can discard it along with the drainage bag, and I will be doing that. And I can just put these to the side for now, and after that, I will be performing pericare on my patient, making sure my patient is all cleaned up, making sure my patient is all cleaned up. Making sure my patient is all cleaned up, and then after I've done pericare on my patient and made sure he's all cleaned up, I will just be taking off my clean gloves. And I'll be performing hand hygiene now. And now I'll be doing my exit safety check. I will be doing my exit safety check, making sure bed is in the lowest position possible, call bells in reach, patient in distress, and there's no tripping hazards. Once I've done that, I'm good to go leave the room and go document my IPN. Some of the things I'm going to be documenting regarding the removal of the catheter is the date and time it was removed, and why it was removed. And the reason was we don't need to monitor patients' ins and outs as closely anymore, and this was removed as per physician orders. And I removed the size 14 French catheter, and the balloon was inflated with 10 cc's of sterile water, and I deflated that with a 10cc syringe. And upon removal, upon draining the drainage bag, I noticed the drainage bag had 300 mLs of pale amber urine with no sediment or foul odor. And upon removal of the catheter, I noticed the tip of the catheter was intact. And it was whole. And now and the patient tolerated the procedure fairly well and was very cooperative. And now we should be monitoring the patient. For any signs and symptoms of infection post removal, such as a high red blood cell count and a fever. And patient is also due to void. Within 8 hours. And if the patient does not void within 8 hours, we will have to bladder scan the patient and maybe think about reinserting a straight Foley cath. And that's everything for my removal, and I will document those in my IPN.